Hello, and this is Dr. Jonathan Flor-de-Lis from the Cebu Orthopaedic Institute. It is almost Christmas, and whether we like it or not, majority of us will go to parties, we're going to eat, and we're going to probably forget a little bit about our self-care, our health care. So I'm going to share with you something something that may make you feel a little guilty. I don't know, but it is to educate you, it is to be of service to you so that you learn a little bit about personal health from your friendly orthopedic surgeon. So let's proceed. Good evening, good afternoon, wherever you are in the world. This is Dr. Jonathan Flor-de-Lis from the Cebu Orthopaedic Institute. Today we're going to talk about patients, practice, and our personal health. So we're going to discuss a little bit about inflammation and disease. We're going to recommend activities that you can do within your own home and talk about health and fitness in terms of longevity. And we'll go also a little bit on the health gadgets and health apps that you can help you during this time. So I'm going to share with you a short story. This is me, and this is my auntie, and she is a very nice young lady. But the thing is, she was 70 years old and she had knee pain, and I actually had to treat her. I initially did not like to treat relatives, but who do your relatives go to? If you're a doctor, they will come to you, they will go to you, they will ask for your help, and you have to, of course, help them. They've been with you since you were small. They've been giving you all these things. It is time to give back to our family, our friends, our relatives. So I treated her, and it's been a roller coaster ride. She got better because of her knee, but she also became a little sick because of some other diseases. And I'm really glad that right now she is in a good place. She's walking. I've seen her in the supermarket with her son, and I'm happy to say that everything went well in the end. But I want to talk about disease prevention because we want to prevent disease and not really treat it. If it's possible, we don't want disease to happen to us. And this is a three-step process that you can use in many aspects of life. This is to number one, scan, and number three is plan. We want to span. I want to take a holistic approach on how we treat patients. A lot of doctors will only focus on the physical, but being holistic, we also want to talk about the spiritual side. Being Filipinos, a lot of us are very deeply religious and spiritual. We want to nourish that side of the patient as well, bringing them back to their faith, especially during these times where they become sick. And that can actually help in the disease process, in healing these patients, bringing them closer to their faith. Another part of the holistic approach is the social aspects. Because of disease, patients tend to shy away from their family and friends. And when this happens, being a patient myself before, because I was diagnosed a hypertensive very early in my 20s, you become depressed for a while. And during that time, you may forget a lot of the good things that are happening. And when I was in the hospital that time, I really realized how grateful I should be. Grateful that I am alive, grateful that I have friends and family within me, so around me. So this is very important, the social aspect, and that's part of a holistic approach to treating our patients. And lastly, there is a certain mindset, a certain psychology, and that's a big part of how we treat our patients as well. Again, most of the doctors will only focus on the physical, on what hurts, but what goes through a patient's mind is just as important, because a lot of patients will spiral down, like myself, into a time of negativity and anxiety and worry because they tend to overthink things, overthink their disease. We have to tell them that it's okay, it's not a big deal. We have to tell them and treat them, treat their feelings, and show them even stories of how other patients got better so that they can actually believe that there is hope. So that's very important the mindset of the patient, and how we deal with this. When I say scan, we need to scan different patients because different patients actually have different symptoms and signs, and we cannot treat each patient with a knee pain the same way. Yes, we need to do a history. Yes, we need to talk to our patients, but also we need to really go deeper into the history and physical examinations to determine how we are going to treat these patients. Some patients may be young, we approach young patients in a different way. Some patients may be a little sensitive or old, so each patient needs to be treated in a certain manner. We individualize each patient, not everything in one box. So we look for risk factors for each patient, young or old, and we come up with a plan to treat each patient, whether it be through drugs or pharmacologic management or non-pharmacologic management. And this can be through a prevention from rehab, exercise, stretches, or even mechanical means like stockings or some form of something you can wear. And these are the pills, injections, and stockings. This is for DVT, or deep vein thrombosis. Let's touch a little bit about inflammation. So when we talk about inflammation, a lot of us think of something swollen or something red or something painful, something hot. And this is all true, but there is also a chronic inflammation that's happening in our bodies that we cannot feel or see. It's inflammation because we are overworked or stressed, the inflammation of the mind, or inflammation that in our arteries, happening in our gut. So there's so many types of inflammations, and this leads us to chronic stress, increases our CRP, which is a marker for inflammation. This is actually being used nowadays, not just for patients, but even for athletes. And the athletes who are overworked and they practice too much, these levels of CRP or levels of inflammation in the body increase. That means they lack rest. It doesn't mean that they are actually having a certain disease. Again, you have chronic inflammation not just in athletes, or it is also in patients with infections or patients who have diabetes, who have disease, who have cancer. So it's a general marker that you see and you can use, and doctors actually use this for many things. Telomere length is something that is being used nowadays to take into consideration biologic age. And what happens with chronic inflammation is we slowly age, or actually we age not slowly but faster than usual. If you're under a lot of stress, just imagine that you are growing older faster because you can't deal with that stress. You don't have time to relax or rest, and you're overworking different parts of your body like your gut or your brain or your arteries. So if you have been through a chronic disease like infections, cancers, or even psychological diseases, you will find that these patients may look a little older than other patients of the same age. And that is what we call inflammaging. Inflammaging is actually the chronic inflammation which accelerates aging. And there is a balance in inflammation with the pro-inflammatory cytokines, and there is actually anti-inflammatory myokines in your body, which you can get from exercise and with active muscle mass. This is to prevent the inflammaging, which can come from cardiovascular disease, insulin resistance, and other diseases like kidney disease or neurodegenerative diseases. So we can actually turn back the clock, because age is just a number. When I say just a number, that can be your chronologic age. That is the actually age that you have in your birth certificate or passport. But we also have a biologic age, which means you may be 50 or 60 years old, but if you've been treating your body right, if you've been kind to yourself, if you've been exercising and eating all the right foods and lessening your stress, your biologic age, or the age of your actual cells, may be younger than your chronologic age. You may be 50 or 60 years old, but the age of your cells is actually around 20, 30, or even 40 years old. And this is actually possible. A lot of people go abroad to inject many things like NAD or even stem cells to get younger, But there are other ways that you can do that as well without wasting a lot of money. So we want to stay young, and we want to know what our biologic age is. And we can do this through exercise. Fasting is really interesting because the Nobel Prize winner for intermittent fasting showed us that we can clean up our body and become younger. And studies already prove this, that especially in some individuals and rats, you can produce new stem cells by fasting for over 24 hours. And that is equivalent to injecting yourself with a lot of stem cells without the injection, without the pain. And mindfulness meditation is something that you can do as well. Stress is a killer. Stress can make you age, and many of you may have seen this. Stressed individuals have more gray hair. They look older because they are undergoing so many things, and you need to relax sometimes. So why else do we need to be fit? Why else do we need to be healthy? This is important because aging causes muscle mass decrease, which is sarcopenia. It also causes osteoporosis, and both can lead to a fracture. And the life expectancy here in the Philippines is approaching 80 years old and above. And I've seen patients who are 80 years old and above, very strong, but have fractured their hips. And the rate of hip fractures is increasing here and abroad. By 2050, we estimate over 150,000 hip fractures in the Philippines. That could be you, that could be me, that could be our relatives. Let's try to prevent this, please. And we hope that this is not true. How do we prevent this? Now, let me show you Joanna Quas. She is the oldest gymnast. I may be wrong, but she is the oldest gymnast in the world so far. And this is through diet and exercise. You can avoid all those hip fractures by just a diet and exercise and keeping ourselves healthy. This is also showing how we can prevent the inflammaging process and uses of heat shock protein 70. So there is a prescription for longevity, and the prescription is not only a good diet, but a personalized exercise routine. Remember sarcopenia, or decreased muscle mass. If you have a decrease in muscle mass, you will have a decrease in bone mass, and you might have a fracture. But when I mean personalized exercise, you may need to go through different doctors to have your heart checked. You want to have your own routine that you would like to do. Don't keep following exercises that you don't really like to do. If you are a runner, go run. If you like to lift weights, that's fine. But you want to personalize your routine. You want to have a certain duration, a certain frequency, a certain modality that you'd like to have that is okay for your busy schedule in this life. Don't just follow other people. That's the point. And like I mentioned, have your own modality, frequency, intensity, and duration. And this is not just for the body, but it's also for the heart. It's really popular nowadays, 10,000 steps. So let's talk about longevity. You want to live a long life, and you want to live a strong life. What is the minimum effective dose for you to live a long life? Is it 10,000 steps? No, it's not 10,000 steps. Or 8 kilometers approximately. It's not 8 kilometers, it's not 10,000 steps. Guidelines only require you 150 minutes of about moderate intensity exercise. 150 minutes a week is approximately 10 minutes or 20 minutes a day, or 2.5 hours per week. Let's talk about fitness. In terms of longevity, this is not how you look or your six packs or whatever. It's muscular endurance. It's cardiovascular fitness and your VO2 max. It is the way you recover from a hard day. That is fitness in terms of longevity. Again, it's muscular endurance and anaerobic capacity. It's cardiovascular fitness and your in your mitochondrial density, which is part of the VO2 max, and your recovery and metabolic efficiency. And there are really exciting and new studies on high intensity interval trainings. One of these is the TABATA. So I'm not really an endorser of TABATA, but studies are showing that it is a very good energy efficient exercise, because 60 minutes of moderate intensity exercise, like just cycling for an hour, is equivalent to 4 minutes of Tabata. That's amazing time that you can save actually. So if you're a busy doctor, you're a busy person, and you want to try out Tabata, have yourself checked out and don't do the routine full out right away. Ease yourself into it and see if this is a perfect fit for you. An example of a Tabata is doing a 20-second sprint on a bike followed by 10 seconds of rest, and you have to repeat this 8 times. After the 8th time or the 8th set, you should be relatively tired, and that's enough. That's why it's equivalent to about 60 minutes of moderate intensity exercise. You can do your Tabata 2 to 4 times a week, and that's just 4 minutes. That's the recommendation. You actually burn fats or burn calories or burn ATP even when you are not doing the exercise. That is the afterburn effect. That is the excessive post-oxygen exercise consumption that you are still burning after the exercise. Cardiovascular fitness is important, definitely, and we actually measure this in terms of VO2 max. And this is the maximum amount of oxygen that you can utilize. You can do this, improve it not just through continuous cardiovascular endurance training, but you can do it through HIIT training as well, high intensity training. And minimum effective dose for you can be 4 minutes of HIIT followed by 4 minutes of rest. 5 sets of that is about approximately 40 minutes, and this is 40 minutes of cardio every 2 weeks. So you can do 40 minutes of cardio every 2 weeks. This is enough to maintain your cardio fitness. That's 40, and then you can do this really easy workout. If you are a busy person, before you go to work or before you eat breakfast, you can do your rounds. You can go do a little jog, and that can be a fasted walk. You can start easy. You can start with just 5 minutes of exercise every day and gradually increasing to 10 minutes to 15 minutes to 30 minutes or 35 minutes. And be sure to drink a lot of water. Water is important because thirst can often be confused with hunger, meaning you may think that you're hungry when actually you are thirsty. And a tip for you is to just drink small sips of water. I know they say 8 glasses of a day. I'm not disagreeing with that. It's just that if you drink and gulp a glass right away, you are more often than not going to excrete or urinate all that water. So try to take small sips of water in that glass, and you want to avoid underhydration. Underhydration meaning you may not have a total water body deficit, but your urinary biomarkers like vasopressin may still be increased, which means you are underhydrated. And you want to be able to recover. When you're doing a hard workout or working hard, recovery is important. And a tip for this is just doing a cold shower or cold immersion. Athletes do this, and Wim Hof is really popular nowadays because of these cold therapies. So there's actually evidence for this. Mindfulness, I have to repeat, is really going mainstream. There are 1,500 studies on mindfulness meditation and the effects it has on the body, and most of them are all positive. So it was something that used to be fringe and woo, meaning this is amazingly some topic that scientists would not talk about. Right now, there's evidence behind it. It works, mindfulness, and top CEOs and top companies are now using this mindfulness meditation. My tip for you is if you're really tired, if you're really stressed, just stop what you're doing, take deep breaths, observe your feelings, and you can even say it with kindness that I'm sad, I'm angry, and try to empower yourself saying that I can do this, I can do the work. This is a challenge, but I can do this, and then you can proceed. Hopefully, once you make it a habit, exercise will become automatic for you. It will be easy. It'll be satisfying. So make it obvious, make it attractive, make it easy, and make it satisfying. This is from James Clear's book, Atomic Habits. And before I end, I'd just like to go to the last part, which is about apps and gadgets that you can use for Christmas. Remember that blue light can damage your eyes, and you may have trouble sleeping. So there are apps for this. There are also blue blocking glasses. There are certain apps on your phone. Your blue light filters may not be enough. That's why there are additional apps. And also for your computer, there is an Flux app for PC or Mac, which can improve your light filters. There are fitness apps. There are so many fitness apps, and they can help with weight loss if you use them properly. And they can even help you get a buddy, an accountability partner, or a partner that can push you. This is relatively new. It's still being studied. It's binaural beats. So certain sound frequencies in your brain can alter your states of mind. Delta for deep sleep, theta for REM sleep and meditation. If you want relaxed focus, that's alpha. Using binaural beats can help you with this. You can find them on YouTube or Spotify. There are even apps for this. And yeah, beta and gamma are for focused attention and memory recall in certain states of mind. There are other apps or gadgets for stimulating your muscles and preventing DVT. This is relatively new and it is being used outside. The principle of the cold vest is for cold thermogenesis. When you have a cold vest on your body will shiver. It will activate your brown adipose tissue and help you burn fat or burn ATP and calories. So they've studied this through fat water MRI and PET scans, and really this is still being studied, but so far the results are looking good. You can't go to the sauna nowadays because of COVID. That's why infrared saunas are gaining popularity, because you can have them in your own home and they can improve your eyesight. They can have that same effect as a sauna, and it's refreshing. It improves your mitochondrial density, and it's something that you might want to try. It can even improve eyesight. I think I mentioned that. And what's new? Smart rings are new. It's being advocated and used in UFC, NBA, NASCAR. They can track temperature, respiratory rate. Interestingly, a ring can monitor respiratory rate. And it's really interesting how it does that, but it can do all the other things that your smartwatch can do. Plus, it can help you with like sleep studies, because as I mentioned, it can help monitor your RR, or respiratory rate. It can help you monitor your temperature, and that's really useful if you think that you have a fever nowadays. So yes, check out the smart rings and how it does things. And these are a lot of gadgets, a lot of things. But remember, this Christmas, your gadgets can connect you with your family abroad, but it can also disconnect you from your family right here, right there beside you. And I am guilty. That's my wife and sons up there, because I was too busy on my phone. So I hope this was valuable to you. I will see you next year. So advance Merry Christmas and Happy New Year from the Cebu Orthopaedic Institute. Hope this was valuable. If you have any problems or concerns, call us at 239-2211. Visit us at our Facebook page, and you can schedule an appointment with your specialist of choice at SiriusMD.com.